So for those of you I haven't met, there's a lot of familiar faces, which is good. But I'm Camilla. I'm a lecturer in nutrition, physical activity and public health with the Faculty of Biological Sciences. I'm one of the co-leads of the Physical Activity Workstream together with Professor Karen Birch, who is the dean of my faculty, and she is so busy that she had to rush off for an emergency meeting. So it's just me delivering this solo today. Okay, so I wanted to just start off setting the scene for this work stream because, correct me if I'm wrong, but I don't think physical activity is a central part of the Dutch group care model. So that makes it perhaps a bit of a unique selling point. So for those of you that are experts in physical activity and health for a range of population groups, I apologize, because I will perhaps see this as a recap then for some information. On these slides that you've got in front of you, you can see the physical activity guidelines for pregnant women and postpartum women that we have in place in the UK. And I think they present a really nice case for why pregnant women and new mothers should be active, and also sort of act as a rationale for why we should have this as a separate work stream within my first 1,000 days. So these guidelines, we have them written and we have them presented in a graphical format in the UK to really try and facilitate easy dissemination of advice by healthcare practitioners to their patients. So they have been designed for healthcare practitioners to use, not for women themselves to engage with. So bear that in mind. So you can see on these guidelines, we have a range of health benefits that have been flagged. And I'm not going to sort of regurgitate them to you because you can read them on here. But importantly, what they have done is they've stated the amount of physical activity women should engage with per week and also the intensity. And then I think what's really key is that they have focused on physical activity rather than exercise because they want to try and make it as accessible to women as possible. So you can see they've got out and about activities, home activities, and then a proportion that is leisure time activity, which is obviously our exercise aspect. And now I'm telling you this because what we want to do within the physical activity work stream is to really try and build on some of these messages within our group care sessions that you see on the infographics. We, of course, also have infographics in place for the early years, so from birth up until 5 years, and I'll be introducing those on sort of a later slide. But for now, the focus is on this sort of early period. Now, we know from the evidence, it is quite clear that engaging in physical activity is hugely beneficial, not only for the mother, but also for the baby. A good example to use is gestational diabetes. So we have a really, really high rates of gestational diabetes. So this is diabetes that develops during pregnancy within leads. Okay, and one way that physical activity can be very, very useful is it can control blood glucose, it can prevent hyperglycemia, can then prevent subsequent gestational diabetes. We know that women who have gestational diabetes, they give birth to babies that are very large for gestational age. They're much more likely to then develop childhood obesity. So if we start early on and get women to be active, we can prevent rates of, for example, gestational diabetes. Despite this, there are many pregnant women and postpartum women who fail to meet the physical activity guidelines. Okay? And studies have reported as little as 12% of pregnant women meeting those guidelines of 150 minutes of moderate activity per week. So quite terrifying statistics, really. Similarly, we've seen in postpartum women, they are less likely to be as active as they were pre-pregnancy. Inactivity levels are much more pronounced in more disadvantaged areas, and we have observed this in Leeds as well, collecting data on pregnant women in Leeds. Now, barriers that women cite to becoming physically active include tiredness, lack of knowledge, family issues, safety concerns as well, and this has commonly been reported throughout the literature. This is then amplified by the fact, and I apologize in advance to the many midwives here who engage with the infographics and use them in their care, but there are many, many healthcare practitioners that do not feel comfortable giving advice on lifestyle behaviors during pregnancy and in the postpartum period. And that includes nutrition, and it includes physical activity advice as well. And that's not because they don't know that a healthy diet and physical activity is great for maternal health. It's because they lack the education, the training, and also they lack, importantly, the time to provide that kind of care, both antenatally and in the postpartum period. And we have observed this interviewing recently UK midwives, asking them about their experiences and their attitudes towards providing physical activity advice to pregnant women and postpartum women. And they really did cite that lack of training as being key. It was also a bit upsetting to see that none of them knew about the infographics that the CMOs had developed to use in practice. And they were not aware of the physical activity guidelines, and especially that postpartum period. The guidelines were only released in 2019, perhaps illustrating that postpartum women seem to be a bit of a missed population when it comes to care. Okay, so it's really key that we need to empower practitioners in order to provide physical activity advice, but also try and make physical activity accessible for those less likely to be active. We know that the women that live in more disadvantaged areas in Leeds, within the UK, I'm sure also in the Netherlands, they're less likely to engage with public health initiatives, including physical activity initiatives. Fortunately, in Leeds, we now have some wonderful, wonderful initiatives in place that we're hoping we can tap into. So I've illustrated some on this slide here. So these are from our partners. I'm winking at some of you out there in the audience. From our partners, Leeds Active, and also Bumps and Babes, who deliver classes to pregnant women and postpartum women. Now, they've done a fantastic job in trying to be as inclusive as possible and trying to make physical activity accessible to those that live in disadvantaged locations in Leeds. So if you look at the Mums and Tots flyer here, these are classes that take place in community libraries in Leeds. So really sort of the heart of the local community. Yeah, and they are, anyone who knows Leeds can see that these are the sort of more deprived areas or disadvantaged areas that we have. We also have Bump and Baby Fit classes. Again, so these are targeting pregnant women, and they take place in Armley in Leeds. So what we hope to do is we hope to really try and signpost our women to these kind of initiatives within their local community and use the group care maybe as some sort of taster sessions for these kind of classes that are taking place. We hope that we can break down barriers that women may have by welcoming women that have gone through these classes. They can come and share their experiences and act as role models to our women. Now, feeding this all into what we're going to deliver within my first 1,000 days, so for the physical activity stream. What is key is that we want it to be participant-led. We're not going to be telling them, you should all be doing yoga, you should all be doing swimming, and so on. That's not how this will work. They need to tell us what it is they enjoy, or what they think they might enjoy, because we have to bear in mind they might not actually be very active. Okay? So we need to listen to them. We have got a list of topics that we ideally would like to cover. We don't have to cover all of them, but they include resumption of physical activity after childbirth. We know that women are very, very uncertain in terms of when they can resume physical activity, but also what they can do. So this is very much dependent upon the mode of delivery. We want to focus on pelvic floor muscle training in preparation for birth, but also in terms of recovery and building up that strength postpartum. Physical activity and safety. We know that safety is a key barrier for women when it comes to being physically active. Physical activity and mental well-being. This is something that we really, really want to focus on. We want to highlight how important and positive it is to be active on your mental well-being. So not only doing the physical activity, but also signing up to classes outside of our group care sessions where they get to meet like-minded women so they can take part in pregnancy-specific classes or postpartum-specific classes, like the ones I flagged on the previous slide. We also want to introduce our women or carers to activities that they can do with their children. So I have included here on the slide the infographic that we have in place in the UK for the early years. So there are lots of activities that you probably can't read right now because it's very small font, but there are lots of examples of activities that carers can do with their children. And then, of course, physical activity and breastfeeding. Perhaps we want to bust some myths there in terms of how active you can be around the breastfeeding period. And then physical activity and the immune system, very contemporary considering we've just gone through a pandemic and are seeing many, many variants of viruses coming our way. Okay, so that is pretty much what we've got in store for the physical activity workstream as we speak. Would really welcome your feedback, both as practitioners and researchers that are familiar with this area. So thank you very much.